Hey guys, Lauren Losing here, and I am here for my technically day 6 post-op plastic surgery check-in, but I had my 1-week post-op appointment with my doctor today. So I am also, I think, 146 weeks out from vertical sleeve gastrectomy surgery. So I had my vertical sleeve gastrectomy surgery on August 21st, 2013 at Massachusetts General Hospital with Dr. Denise G. I had my plastic surgery, which was an arm lift, a breast lift with silicone implants, and a 360-degree lower body lift on May 26, 2016 with Dr. Amy Caldwell, and that was also at Massachusetts General. So my first appointment at the weight center, I was 269 pounds. Side note, I am 5'2". Surgery day for VSG, I was 245.5. So I have not weighed myself since my plastics. I am definitely swollen. I might step on the scale at some point just for curiosity of like how much water I'm retaining, but I don't intend on stepping on the scale to get a like true weight for another couple weeks, maybe when I'm like 4 weeks out, around there. So the morning of my plastic surgery, I weighed in at exactly 125 pounds. So, yet again, that was my lowest adult weight that I've seen, so I was excited for that. I'm not really gonna get into the, I'll get into some of it, I guess. Some things that I guess are good to know. Very uneventful once I got there. When they brought me down to the OR, like to wait outside, and my surgeon was marking me, one of the things that we had talked about in our Google Hangout last week, you know, with the girls that I talked about, Amy had asked if the ladies who had already had plastics gave their surgeon input when they were being marked. And I was like, I can't imagine giving my surgeon input on like where to mark me. She's the expert. I'll take what she says. But my surgeon actually did, not in every area, but she actually did ask my opinion on certain things when she was marking me. I mentioned, you know, that I wanted this loose skin under here removed, and she just, she also had like someone who was also a plastic surgeon, but she was someone who she was teaching like her technique. So she was like, you know, some people don't like this scar, so we can not do that and just bring it over here. And I said to her, I said, nope, I'd rather get rid of the loose skin. I don't care about the scar. So that was somewhere where I had input. Sorry, I keep touching my boobs. I'm not used to this. And then she also asked for my input when she was marking me on the sides, because she said, we can do these, she said, I usually do these lower, but the way your body is shaped, if I do them where I usually do them, your sides are gonna be like straight up and down. She said, I can do that. She said, but if you don't mind the incision being a little higher, then I think that will give you a more feminine shape. And so I said, that's great. That's what I would prefer. And then she also had told me that she could make her, you know, she could make her incisions respectful of my tattoos, and I just reinforced that I'll worry about the tattoos later. I really just want the best results now. In respect to my tattoos, things did not turn out the way that I had thought they would. I think that's just from me not really exactly understanding where the incisions were going to be made. I thought the incisions on my hips would be lower. So because she made them higher on me, I actually retained both of my hip tattoos. If she had made them where she usually makes them on other people, I would have gotten rid of them. And then my back tattoo, I didn't realize how low they make the back incision because they really remove most of the skin from like your buttocks area and pull that part up, as opposed to removing it from like higher on your lower back and pulling that down. So I retained all of my star. The way she did it, she did it like respectful of my tattoos, but she just removed the words underneath. I kind of love how she did that actually, because the words were the part I didn't like. So yeah, that worked out perfectly. As to how much skin was removed, should I get into that right now? Let's get into how I feel like I should put like an asterisk or a notation saying results not typical next to me. Not like body results, because I think if you go see a good plastic surgeon, you will get great results. I feel like my recovery should come with the warning of results not typical, because my recovery has been great. I've used my medical recliner, which I think is helpful. I do like using it. I think I could have gotten away without it, but I do think that it was helpful. My mother has been preparing all of my food, so I don't have to, you know, stand in the kitchen and prepare it and bring it back, so that's been very helpful. I used the toilet seat riser for the first 5 days. I don't think I would have needed it at all, honestly. Let me preface this by saying I appreciate all of the suggestions and everything that people gave me before. I'm having a very different experience from the people that I talked to, which just shows that this is all individual. You can't predict what's going to happen for you. The highest my pain level has been since surgery has been a 5. And, you know, for those not familiar, in a hospital setting or a medical setting, they ask you to rate your pain from 0 to 10, 0 being no pain, and then 10 being, well, if you're in a 10 out of 10 pain, then you'd be passed out. No one really experiences 10 out of 10 pain. You would not be conscious for that. So that's how I explain a pain scale. So mine didn't get above a 5. Yes, I was on IV Dilaudid. While I was at the hospital, I had no nerve blocker. I had no pain pump. I didn't come home with a pain pump. I came home on oral oxycodone, normal amount, you know, 5 to 10 milligrams every 4 hours. It is day 6 right now, and I am mainly on Tylenol to control my pain. I can almost fully stand up straight, not 100%. It looks like it from the front, and although I'm sitting up pretty straight, it looks like it from the front, but I am still slightly hunched over. She did do some muscle repair. So from what my surgeon was, you know, surprised too. She was like, "You're in really good shape." This also, I guess, proves that just follow your surgeon's instructions, because each surgeon is going to do things differently. So I talked to Dr. Katzen when I was in Nashville. If I had gone to Dr. Katzen for my surgeries, he would have had me on bed rest, 100% bed rest for 2 full weeks, and just giving myself blood thinning injections. I would have gone bonkers, apeshit crazy, I think, if I had to stay in bed for a full week. I've been getting up since the morning after my surgery, and I think that I would go freaking out of my mind if I had to lay in a recliner for 2 weeks. So it just all worked out perfectly for me, basically. My surgeries, my surgeon, me, this all came together perfectly. I had 6 drains, and let's see. I'm kind of skipping all over the place, but I also don't want to forget anything. So, I had my first shower today. I was able to shower by myself. I did not need a shower chair. I stood up the whole time. I definitely got like I felt spent after, and I had to sit down after, but I washed my own hair. I can't lift my arms up all the way, but I can bend my head down and I can touch my whole head. I'm the one who put my hair up today. I put my makeup on. It's just, I don't feel like these results are typical for the extensive amount of surgery that I had, but I am so grateful that this is how it's going. So I had my post-op appointment today. I saw my doctor. I had all of my dressings removed and changed, so I'm not going to be able to show you guys my incisions. The only incisions that are open right now, and I'm actually going to be covering them, are the ones under my arms that connect my arms down to my breasts, and you can't even really see them right now. I am going to be just throwing something on there just because I don't like the fact that they're open. My arms are covered right now, so I'm not going to be really showing you that. So, one of the reasons my surgeon thinks, excuse me, that I had such a great recovery, aside from the fact, the other factors of that I'm young, I'm in excellent health, I have a good amount of muscle to support, the rest of my body and all that stuff, is that she said, you lost all the weight on your own, and I feel like I had weight loss surgery, but, when you came to me, literally all you needed was the skin removed. She said she feels like people have a harder recovery when they need a lot more lipo and sculpting and stuff like that. So she really suggests for people to go to a plastic surgeon, and this isn't what you have to do, but she just said it seems like people have an easy, excuse me, my bra is coming unzipped, an easier recovery, because lipo is extremely traumatizing to the skin. She just feels like it's an easier recovery. Now, because of the fact that, the only places she did lipo, I believe she did some lipo on my arms because they're bruised. She actually didn't mention that, but I believe she did. But she actually didn't need to do any lipo on my stomach, which I was very surprised about. No lipo on my back. She just did it on my lateral thighs to even them out. She did a little bit of lipo on my right side and then more lipo on my left side because I had more fat on my lateral left thigh than on my right. So yeah, you'll see a lot of, I'm gonna show you what I can show you, and you'll see more bruising on my left. So yeah, that felt really good. So because she was removing just skin and not fat attached, my skin really did not weigh that much. So I didn't ask her how much she removed in lipo, but she said the skin that she removed between my arms, my stomach, and my back, and I did get pictures, but I don't want to show you the pictures just because their color printer wasn't working very well, and so it's all like hot pink, so you can't really tell, excuse me, what everything looks like. So between all that, it was only about 5 pounds. So that would bring me down to about 120 pounds. My breasts, so they are 325 cc silicone implants. My breast implants weigh about 1.5 pounds altogether. So if I step on the scale in a few weeks and most of my swelling is gone and I am below 121.5, that means that I lost more weight on my own, which is what I'm expecting. I am honestly expecting to end up somewhere in the high 1-teens. Why is that? Because my restriction has been crazy. I have been able to get in about 500 calories a day, and that is because I'm making myself drink a protein frap every day. I'm drinking one of the, like a half of a Premier Protein blended with some Halo Top ice cream, and that has 200 calories, but that's like, I'm eating egg beaters with cheese in the morning. I can only eat a quarter of a cup of that. Most nights I've had chicken with sugar-free barbecue sauce. I can eat about 1.5 ounces of that. So I'm really not getting in a lot because I can't. I did have, I'm just trying to think of everything. I did have some constipation issues after. I didn't go for about 4 or 5 days, but once I went, I was taking Colace, Senna, and then I started taking Miralax several times a day, and then once I went, I really kind of couldn't stop going, so I have cut down on all of that. I would say that's very important. Like, start working on your poop stuff immediately after, because I was holding, like, this is gonna get a little graphic and TMI, but I was like, when I was pushing, I felt like my ab muscles were gonna rip apart. So I had to like push in on my stomach while I was doing that, and then that made it feel better. All right, so I will show you guys. My drains are attached to my binder, so if you guys don't like bloody looking stuff, then you probably shouldn't watch this part. They look like 2 little hand grenades. So I do have a lot of swelling. When I looked at my incisions and everything, it looks good to me. I think that that's coming from a medical background, coming from someone who watches a lot of plastic surgery shows. I know that it is going to take a couple months for my breasts to, first of all the swelling to go down, for my breasts to settle. They're very high right now. So for them to settle and for all the swelling to go down, and then for, you know, my incisions to heal and all that. But to me, as a medical professional and all that, they look, I can see that they look great, and I'm gonna be very happy. A little itchy though. So I posted a picture in my Women's Only Facebook group, and I said, you know, like, if this is what I look like with swelling, I can't wait to see what it looks like without. And Lindsay kind of commented that she couldn't see any swelling. It's not as much, I mean, you can't see it as much as I can feel it, and I'll point out where it is and where I can feel it. But I definitely, let me stand up. Oh, hold on. If I stand, hold on, I'm gonna do a little test shot. Hold on. Okay. So this is definitely swollen up here, and then the implants are high. It's swollen over here, and it's just kind of swollen all around. My back is swollen back here. I have that like SpongeBob square butt going on right now. And then, sorry, these are my drains. And then it's definitely swollen like right here. I don't know if I turn to the side if you can see it a little, but definitely swollen like right here and then in here. So let me just take my binder off and I'll rest my drains on the counter. And of course I ordered a, sorry, it's just boobs. I ordered a new binder from Amazon, and did they send me the right size? No. All right. So this is my new belly. My belly button is covered. They told me really not to mess with that. So as you guys can see, I'm gonna have abs. How insane is that? So I have to show you guys where my tattoos ended up. So my hip tattoo is literally right next to my torso tattoo now. It used to be all the way down here. So that's kind of funny. I still don't like it, so I'm gonna have to figure out a cover up. I'll probably do some like roses, black and white, black and gray roses or something around this. I don't want to take this off right now. I think that part of this got screwed up, but I'm not sure. So let me tilt you down a little. So this is basically the stomach I've always wanted, and I'm so excited. So these are like the lowest rise underwear you've ever seen in your life. So this will be covered in a bikini. See how these incisions come up higher, and then the back will be covered. But see how these come up higher? That's what she was talking about with giving me like more of an hourglass shape and not like having them down here and giving me straight up and down. You can also see how much, hold on, I have my pants like around my knees. You can see how much more swelling is on my left thigh right now than on my right. And then like the kind of, I'm sorry, it's like juggling. The like minimal bruising that I have here from the lipo. And then a lot of bruising that I have here. And this is all super swollen right now. I'd say by a couple of inches, an inch maybe, like a lot. So this is not swollen back here, and I think you guys can see the induration right here. So that will be going down. I haven't been wearing a girdle or anything. They actually didn't have a small enough one at the hospital, which felt very good. So I've been wearing compression yoga pants, and she said that was totally fine to wear like compression shorts or compression yoga, like capri pants, and that's what I've been wearing. Excuse me. So, this is my incision. It's obviously covered in a steri strip right now. This is not swollen up here, and that's the majority of this, guys, right now is numb. So this is all numb right here. My belly button is completely numb, all numb here, and this is all swollen. So I know it doesn't look like it. I know it looked like I have a very flat stomach right now, but it's going to be even flatter because this is all swollen right here. What else did I want to say? Oh, the drains coming out were like no big deal at all. They felt like nothing, and I think that's partially because I am so numb. So this back here, I actually developed, I'm like, I feel like I should be bending over to talk to you, but then you're just looking at my boobs. But I mean, not a bad thing to look at, is it? I developed a blood blister back there from the tegaderm from like having so much adhesive on my skin. So that's just that covered. One of my drains came out of here, and that's why you see a little blood there. One of my drains came out of there, and then both of my arm drains came out. So, alright, so this has been sufficiently long, and yeah, I'm really excited. I can't believe I'm not even a week out and I feel like this. I am very excited. Lisa, is today her day? Yes, so it's Wednesday in America, which means that it's Thursday in Australia. So it is Lisa's surgery day. Good luck, Lisa. I know you're gonna do great. I am so proud of you. And I am so excited for Lindsay to come visit next week. And it's her 2.5-year surgiversary, so happy surgiversary, Lindsay. And I'll be coming to you guys again when there's something to update on. All right, until next time.